Welcome everyone to the Better Breathers Club of BC. This is our monthly support group, a collaboration with Poplar Pulmonary Wellness funded by the BC Lung Foundation. Thank you so much, BC Lung Foundation, for putting on this support group. This support group is open to anyone living with a chronic lung condition, any chronic lung condition, as well as their caregivers. And we often have a theme or a topic we review, we bring in guest speakers, and today we're going to be talking about breathing techniques. I'd like to acknowledge the lands on which we gather here today. This is the unceded ancestral traditional lands of the Coast Salish people. And for me in Vancouver, that's the Musqueam, Tsleil-Waututh, and Squamish Nation. So I know people come in from all over our province. So if you'd like, you're welcome in the chat to put the lands on which you're attending this afternoon. We like to create a safe space here in our Better Breathers Club of BC. We welcome everyone to share their thoughts, their values, their opinions, especially your questions, without any fear of judgment. So we thank you so much for creating this safe space for everyone. The information that we share here today is for educational purposes. It doesn't substitute any specific medical advice from your healthcare providers. So if you have specific questions to your personal health, we're happy to help facilitate that, but also to go back to your healthcare provider. We have a couple announcements before we get into the main bulk of things today. So I know we've got some harmonica players, old and new, in our group today. We are recruiting for our Harmonicas for Health and Happiness program, both for our March 2nd session as well as our May 25th session. So playing the harmonica can improve muscle strength, lung capacity, as well. It's fun. You get to learn a new instrument, and we have a lot of fun together. So if you're interested, if you want more information, do give us a phone call or an email and we can provide you with that. These classes take place on Mondays between 1 to 2 p.m., all online over Zoom. And as we do our support group sessions, sometimes questions come up specific to your lung health situation. So if you're looking for more guidance, we do want to remind you, we do have a registered respiratory therapist in our online clinic. You're welcome to a free 15-minute phone call. So call us at any time. Our number's posted there as well as our email. In our clinic, our respiratory therapist can guide you through personal respiratory care plans. We can work together with your healthcare team and you don't need a referral. So just start with that phone call. So let's get into our session today. As I mentioned, our session's a little bit different. I'm going to be muting when we're breathing, just so we could all focus on our own breathing patterns, and then unmute when we're having conversation. In terms of Zoom, I know we're all at different levels. When I'm focusing on a breathing pattern where I'd like you to see me, I'm going to highlight me on your screen. And then at other times, you're welcome to maybe view everyone as we sort of breathe together. It might be nice to see everyone on your screen, or sometimes you have a setting just where you see me speaking. So just offering that that's something Zoom is able to do. And if you are on your phone or iPad, you might have to swipe left or right to see everyone together or to see me alone. So just let me know if you're having any trouble with that. We're going to breathe a lot today, and we're going to do conscious breathing, focused breathing. Might make you thirsty. So I invite you now to do two things. To take a couple minutes to grab some water if you haven't done so already, or just have something nearby, as well as to make your sitting position as cozy as comfortable. That can mean have an extra cushion, just feeling comfortable in your chair. We're going to go through two breathing techniques today. One is very functional, where you'll need to be sitting upright, but one is very calming and relaxing. And so I invite you to take a relaxed breathing position. So do what you need to feel cozy today. Does that sound all right?
Yeah.
Okay, excellent. And then as we go through, I'm not going to coach it, but take the water breaks whenever you need to. All right, this big world of breathing techniques. We were talking before we hit the record button about some breathing techniques that our group uses, and we had belly breathing come up as a technique. We've had nasal breathing that focuses on short breaths in through the nose. And I'll talk to you a little bit about that, why it's helpful to breathe in through the nose. And we had a question in the comments about box breathing. And box breathing is a pattern of breathing that involves you visualizing a box and you're inhaling. So if you imagine the box having four sides, you're inhaling for a period of time, often a count of four. You're holding your breath in for a count of four. You're exhaling over a count of four, and then you're holding your breath at the end, exhale for a count of four. And so there was a question if this is a good type of breathing, if this is a breathing we're going to review today. So we're not going to review this breathing today. I've opted to tap into breathing techniques that don't focus so much on a count of your inhale and your exhale, because everyone's lungs are different. And what's going on in your lungs, like whether you have something obstructive like COPD or something restrictive in your lungs like pulmonary fibrosis, that's really going to change on what your counts are. So what that means is how long you inhale and how long you exhale is going to be really different. Often those with COPD or obstructive lung diseases like bronchiectasis or asthma, you can often exhale for a really long time. Whereas those with pulmonary fibrosis or stiff or fibrotic lungs, your exhale is not going to be as long. So today I'm offering you two techniques. One is functional that will offer deep breathing, conscious breathing, relaxed breathing, and breathing that can help to bring up mucus. And that's called the active cycle of breathing. So that's going to be our first technique. And then the second breathing technique is more focusing on calm, relaxation, and also reduce a breathing technique that can help to reduce our anxiety and depression, which is very common when living with a chronic lung condition. And that's more mindful breathing. And today I'm going to guide you through a guided meditation. And so those two techniques don't focus on the inhale and exhale count as much. Box breathing, still a great breathing technique. All breathing techniques that help you to focus on your breath are generally good, generally not that harmful, because your body's going to give you feedback on whether something's working for you or not. And if you want extra guidance on a breathing technique that works with counts, how long to inhale, how long to exhale, I encourage you to talk to us, call us, book your free welcome session, and we could figure that out on a personal level, as well as going back to your healthcare providers if you like. Does that seem okay for our session today?
Mm.
Okay. So we're going to keep things a little bit general, but I will offer some cues to guide you through how to personalize the two techniques we're doing today. The active cycle of breathing. Has anyone heard of this?
Yeah.
Yeah?
Yeah. We did it through the pulmonary rehab.
You're absolutely right. Yeah, we reviewed this in our Poplar Pulmonary Rehab program, and many rehab programs out there review this. It's a common technique that physios use to, respiratory therapists use to help with mucus clearance. And the reason why I opted for it today is because there are about 4 different steps to this breathing technique. And each step offers a way for you to focus in on your breathing a little bit more. Um, and so this technique can be done in seated, ideally not lying down, but a little recline will be okay. Um, it cycles through the 4 steps. I'm going to go through each of the 4 steps, and then in our next slide, we're going to breathe the cycle together. Um, you know, this breathing technique has been known to me as a respiratory therapist for a really long time. So for this talk today, I wanted to go back and look, okay, is this still a good technique? Is there anything new in the research? And the research really says that uh, this technique works. And the way that it can work is to help you with mucus clearance. The research shows that if you do this on a consistent basis, you can maybe get some small gains in terms of improving your lung function. This breathing technique does work to reduce breathlessness. And in some of the research studies, it does show that it can improve your quality of life, again, when used regularly and consistently. If we start up here at the top, and can you see my cursor okay? Yeah, okay. If you start up here at the top at controlled breathing, this is your conscious, what we call a conscious breathing. So when you're going to do this technique, often you're doing this maybe in the morning as you wake up, or perhaps at night before you go to bed, only because those are 2 common times people want to clear their mucus. Um, and you're taking this moment to have, to do this breathing technique. So, I invite you to think of your breathing techniques when you're doing them to create a space for yourself. Go to a quiet room, have what you need handy, make it comfortable, make it relaxing. Maybe you dim lights, maybe you close your eyes. I was going to show this later. Maybe you have a non-flammable candle going, whatever you need to do to make this a nice space. The controlled breathing starts with posture, really, and it starts with us sitting upright in a relaxed sitting position. And we're really focused on releasing upper body tension. So our muscles in our neck, our muscles in our shoulders, we're consciously trying to push our shoulders down away from our ears, not in a forceful way where the muscles are tense and pushed, but just in a way where you're just kind of allowing what we call our accessory muscles. So in our neck, our shoulders, our chest, our back, to just release, to release. And so when we do that, we reduce our work of breathing and we can optimize the oxygen that's available in our body, in our tissues. So sometimes we can walk around a bit tense, or if our breathing is feeling really difficult, we can overuse these muscles and they get tense. And so sometimes the conscious relax there and relaxing the shoulders can really help. From there, we start to breathe in through our nose. And so you had mentioned this, Susan, and breathing in through the nose can be really helpful because it's our natural filter and humidifier. So it makes the breath nice once it reaches our lungs. It's warmed, it's humidified, it's filtered from irritants, debris, allergens, things that can trigger our lungs a little bit. So sometimes when you're having trouble with your breath, just focusing on the in-breath through the nose can be really helpful. And then to start with, in terms of your exhale, you're exhaling through your mouth. And often we want the exhale to be a little bit longer than the inhale. And as I mentioned, I'm not going to offer any counts because that's going to be different for everyone, but just a general rule that making your exhale longer than your inhale can help get stale air out of the lungs, right? Can help to reduce trapped air. We just want to breathe out longer than we were breathing in. For those of you that have learned pursed lip breathing, which can be really helpful in obstructive lung conditions, you might want to purse your lips And this can be helpful if you have restrictive lung conditions as well. Um, but for everyone, again, it's going to be a little bit different. Pursing lips helps to stent open our airways. And if you look at my video screen for a moment, if you have obstructive lungs, asthma, COPD, bronchiectasis, prone to swelling, there might be mucus in there. And so you can see that airway's obstructed. And so by creating pursed lips, we create a bit of back pressure in our airway system. And that can help to stent the airways open instead of them flopping, trying to squeeze this, flopping closed. A little extra air, a little extra pressure, you can imagine, can stent that open and create a little space for air to flow. For those with restrictive lung conditions, pulmonary fibrosis, interstitial lung disease, that stenting of the airways isn't so much the issue that's happening in your lungs. It might still feel nice. And if you have both conditions happening in your lungs, obstructive and restrictive, pursed lip breathing can work as well. So you're either exhaling just normally or you're exhaling through pursed lips. Any questions there with the controlled breathing? Okay. The second step of this technique focuses on deep thoracic breaths. Deep thoracic breaths. And these are breaths that try to get deeper down into our lungs. So we're focusing then more on that belly breathing. And Rod had mentioned belly breathing. So sometimes hand on abdomen, hand on chest. And activating our diaphragm to help take that bigger belly breath, pushing our abdomen out into our lower hand, and then releasing. The other thing I wanted to show you, other than the diaphragm with these deeper thoracic breaths, is our ribs. And I've got this little bucket if you look at my screen. And our ribs are anchored. And as we inhale, they kind of go up like a handle on a bucket. And as we exhale, they release. As we inhale and exhale. And so these deeper thoracic breaths are offering you a chance to cue into your rib cage and really feel the breath filling up the lungs and releasing and filling and releasing. And so there's a more volume of air going into the lungs with these breaths. We can start to, if you're doing a breath hold, so if you inhale, and then if you're able to hold your breath in for 2 to 3 seconds, we're optimizing again air, trying to push past or move past obstructions in the airways. Things like, for example, mucus plugs or areas of the lungs that are collapsed, like the little alveoli sacs, those grape-like structures. That for some of you, sometimes they collapse. And so you're trying to move air into these underventilated areas by taking these 3 to 4 deep breaths. Now, I've offered that with these deep breaths, you can hold your breath in. That may not be for everyone, depending on how you feel with that. It may not feel comfortable. You might have other things going on in your body. For example, dealing with blood pressure, things with your heart, where just holding your breath just might not feel comfortable. So you don't have to hold your breath. That's just an option, and it's something you can just try out and see how it feels. After these deeper thoracic breaths, we go back to controlled breathing, because what this cycle is trying to offer is for us to stay in control of our breath, knowing that breathing in this way might start to move mucus a little bit. And so we might feel the urge to cough. We might get a little irritated. So after we do anything a little hard or a little deeper, like deep breaths or huff coughing, which I'll get into in a little bit, we always come back to that controlled, relaxed breathing because that physically taps into the muscles that we have around our airways and trying to relax those muscles so they're not as fidgety and twitchy. And that can keep this breathing technique more comfortable. Often you're doing this breathing technique perhaps over a span of 10 minutes or so. You're going through the cycle, going through the stages, either until you get a good effective cough and maybe you cough out some mucus and things feel clear and you feel pretty good. You can end it earlier. But sometimes if you're just doing this as a maintenance breathing technique, you might go for, the full 10 minutes or so. Just listen to your breath and your body. Once we cycle through controlled breathing, deep breathing, back to controlled breathing, then we add in this piece that's called huff coughing. Has anyone ever heard of huff coughing?
I have.
Yeah. Yeah, some of you have. This is a gentler type of a coughing maneuver. So often when we cough, it's a reflex. We don't have to think about it. We close all our vocal cords and we cough. Kind of gives that hard C, like a, okay? When we have a lot of mucus, when we're doing techniques like this, our goal is to have an effective cough. So a cough that brings up the mucus without spiraling us into a coughing episode or a coughing fit, which can be really uncomfortable and we can lose control of our breath. So sometimes for some of you, a huff cough can be gentler. And a huff cough is a cough that keeps the vocal cords open or it keeps our glottis open. And it's almost as if you're fogging a window. It comes from the back of your throat. So your vocal cords stay open and the air gets pushed out. You're tapping into your diaphragm here. So you're going to feel your abdomen do a sharp inward as you huff the air out. There are two types of huffing. If you're working on getting mucus a bit lower, so maybe you feel something, we can only cough mucus when it's right about here, upper chest. It's moved from the lower airways, it's moved from the peripheral airways central, upper chest to where we can cough it out. But that doesn't mean we don't have mucus, other areas of our lungs that we're trying to work. We're trying to move it, get it to move up and out. So at some point in the cycle, you could opt to do a low, slow huff. Okay, so this is where you take a breath in and then you huff it out, vocal cords open, low and slow. Abdomen, diaphragm pushes in, muscles squeeze slightly, and you're pushing that air out with open vocal cords. You might not get mucus coming out. Again, it's meant to push mucus more centrally and upwards to where it could come out. You continue on in the cycle. When you feel like you have mucus here, you're ready to huff or cough out, then you can do a higher huff. These are shorter huffs, and there you often can do two, one right after the other. So you would take a breath in and go, okay. And then you'd cough out into a tissue. When you cough out mucus, always look at the amount that you cough and the color, because that can give a lot of information either to relay back to your healthcare team, as well as for you to know and look for early signs of change. Like, am I getting a flare up or an infection? Is it changing? Is my mucus changing to darker yellow or green? Is it getting thicker? Or does it look normal? Does it look like it's my baseline? So I'm going to stop the screen share there for a moment just to see if there's any questions because I just offered a lot of information. And then when we come back to the screen share, we're going to go through the whole cycle together. Okay. So any questions about the active cycle of breathing?
Is controlled breathing just like regular breathing, like you would just
Yeah.
regularly breathe?
Regular conscious breathing where you're focused on posture. So you're sitting upright, you're sitting comfortably, you're focused on inhaling in through your nose, and you're focused on exhaling longer than it took you to inhale.
Right. Okay. So proper breathing, in other words. Okay.
Yeah. Yeah. It's kind of, other words for it might be conscious
Just
breathing,
yeah.
pursed lip breathing. Yeah.
Okay.
Huff coughing. How did we feel about that? Has anyone tried that before?
Yeah.
I think I'd asked that. Yeah, we had some people use it.
I had a
Do you find it?
lung
Go
ridge
ahead.
infection, so that's what they had me do after.
Okay. Thanks for sharing that.
You have to do it like more than one time at the end? Like, is it yours? How fast do you have to do it? Like,
Yeah, so why don't we take a moment? We could do it all together right
okay.
now if we like. And I encourage you to have tissues handy. I've got my tissues handy. This sometimes unexpectedly, mucus might decide to flow. So you're in a safe space. So feel free to or cough out or huff out into a tissue. So huffing, as I mentioned, the two types, the low and slow, when you're just sort of working things up. So let's try that together. So we're sitting up tall, feet are flat on the floor. We're going to inhale through the nose and then keep the vocal cords open like you're fogging a window. Try again. Inhale. Good. And then let me know as you do that, what muscles are you feeling? So where in your chest are you feeling something? What would you say?
Diaphragm moves in.
Diaphragm.
Yeah.
Yeah, the belly, the diaphragm.
Yeah. Yeah.
Okay, great. I find that that's the key one. The huffing, interestingly, the air that is getting huffed out, when I was looking back at the research, can actually be a little faster than a cough. So what that means then is that the mucus that we're trying to push out here, that means that the air can actually move quite fast, potentially through obstructions in behind any mucus plugs to help push it and move it up the airway and out. So that was new information for me actually, because I didn't actually realize how coughs could be the amount of the speed or the flow of the air can be faster than a cough. Then once it gets here, once you feel rumbly, you feel like, okay, stuff is sitting here, I'm ready to cough it out. Then what they suggest is 2 huff coughs in a row. So these are quicker. Still, the vocal cords are open. The first huff is meant to get things central, and then the second huff is meant to get things kind of out, or just continue to push it where it can come all the way out into a tissue. So let's try that together, and I'm going to have my tissue handy too. So let's try that together. 2 short huff coughs. We're going to inhale and good. All right. How do those 2 short huff coughs feel?
Yeah.
Okay.
Feel it coming up.
Feel it coming up.
Coming up. Yeah.
Excellent. Okay. I'm going to come back to our presentation here and let's go through the active cycle of breathing together. Can you see that okay?
Mhm.
Okay. So I have just the cycle here. And let's go through it twice, just for the sake of time. I thought we might have more time to go through it a bit longer, but let's go through 2 cycles together. I'm going to coach you through. You're welcome to mute yourself if you feel like you'd like to, if it feels like you might get a cough out of this. We're sitting up tall. We're feeling relaxed. We're not feeling like our back is arching or that we're uncomfortable. We're just trying to get relaxed, feet flat on the floor. Drop your shoulders down. Feel like your sit bones, your bum muscles are really connecting with the chair, base of your spine. Okay? Start your controlled breathing. In through the nose, out through your mouth, and just notice. Maybe we start to notice the warm air in through our nostrils. Maybe we do some pursed lips if that feels good for us. Now we're going to head into the deeper breaths, 3 to 4 deeper breaths. And I like to cue this by hand on chest, hand on diaphragm, on belly. And that hand on belly is cueing our diaphragm to move, to engage, to take these bigger breaths. So as you inhale, feel the abdomen push out into your hand. And as you exhale, feel the abdomen release. 3 to 4 deeper breaths here. Shoulders stay low and relaxed. And then I invite you to try the breath hold. Inhale. Hold your breath in. 1, 2, 3. Exhale. One more time. At your own count. Inhale. Hold your breath in. 1, 2, 3. Exhale. Okay, come back to controlled breathing. So just to cue my own body, I relax my hands again. Just normal breaths. You can stay in controlled breathing as long as you need to, especially if you feel irritated and like you need to get your breath back under control. And then when you're ready, those deeper breaths, hand on chest, hand on abdomen, big belly breaths. Can you feel the rib cage expand? Are ribs working like the handle on a bucket? You can try the breath hold again if you like. Back to controlled breathing. Now, those that want to try the Huff Cough next, if you feel like you've got something to huff out, you're welcome to do 2 Huff Coughs. I'm going to guide us through the low. I personally am going to do the low and slow Huff Cough. But have your tissues handy here. And when you're ready, Huff Cough the way that feels good to you. So breath goes in through the nose. Noticing those muscles really engaging and working for you as you huff. Come back to controlled breathing. In through the nose, out through the mouth. Okay, I'm seeing things happening. So I'm actually going to stop us in the cycle right there. Good job, everyone. Thanks so much for doing that cycle together. Stay in controlled breathing for a bit if you need. And yeah, let me know if there's any further questions about this technique.
I have a question. When as soon as I go to deep breathing, I cough
Mm-hmm.
every time.
Every time.
every time.
Um,
I don't know what
and
to do about that.
so that's a great comment. So it reminds me of a couple things I could offer. So sometimes it could be helpful if you have been prescribed a quick relief puffer, you're a reliever puffer, that you could take that before you do a technique like this, because that can help to calm or relax the muscles around the airways.
I don't have any puffers.
Sometimes, though, yeah, if you don't have a quick relief puffer, sometimes, yes, this can be irritating. And I especially find this to be true with pulmonary fibrosis or ILD.
Mhm.
And so you just might have to take just longer in the controlled breathing. And maybe you're not staying as long in the deep thoracic breaths. But obviously, something is moving, air is moving, but air is irritating at the same time. And so you might just have to play around with how long you stay in each of the parts of the cycle.
Okay.
Okay. Um,
Uh,
it's
one more.
you could. Oh, go ahead.
Well, one more question is once, quite a long time ago, a physiotherapist said, lay upside down on your bed
Mm-hmm.
and breathe in and try and then cough out. Is that a good practice? Like, so you slope your
So,
bed like that with your head down.
so that
Is
is using what we call it's a postural technique, and I would say that the research suggests that postural techniques for breathing techniques and mucus clearance is really most effective if you have quite a lot of if you have a lot of mucus or coughing out.
okay.
I want to say they said like about 2 tablespoons or more a day, because you're using gravity to help
Yeah.
move the mucus. And so to get effectiveness, you need quite a bit of mucus that you want to kind of move and get out.
Okay.
So the last time I looked at the research on that in particular, it didn't seem like they suggested as a regular thing for the
Okay.
broad respiratory client.
Okay.
Just if you had a lot of mucus you were looking to clear on a daily, regular basis.
Thank
And
you.
so to answer your question, or
Yeah.
potential question, could something like that make the coughing less or make it less irritating? And I want to gravitate to no, probably not. Yeah, the best posture I would say is upright and relaxed, or perhaps a little inclined, or a little more forward. So we often offer what we call a breathing position to calm the breath, which is a little more forward. It uses
Mhm.
gravity too, but in the other way, where you're getting gravity to help drop your chest cavity open and drop your diaphragm, so that you can get some potential bigger breaths, maybe calming breaths from your earlobe down through neck, shoulder. You're all relaxed. Your arms are relaxed, but you're forward slightly. Okay, so that may be another position you could play around with.
Thank you.
You have no problem. Great question. All right, I'm going to move us along because as I imagined, uh, I don't want us to run out of time for this technique, which is mindful breathing or guided meditation and imagery. So, has
Mm.
anyone done this type of breathing before? Or do you practice it currently? Who's heard of mindful breathing?
I've heard of it. I have.
Heard of it?
Yeah, I heard of it.
Have you ever tried any mindful breathing techniques, Marilyn?
Well, I don't know if I have or not. When I lay in bed at night, I am very conscious of my breath, like I do it for maybe 5 minutes, very conscious
Yeah,
breathing.
yeah.
I'm laying in bed.
I love that. Yes. So mindful breathing is an umbrella term for many different kinds of breathing techniques, meditation, yoga, guided imagery. There's all these words that fall under this umbrella. I'm going to give you a definition of what mindfulness means, and I'm going to read it directly from the Canadian Association of Mental Health, because I think that they just wrote it out so beautifully in a way that makes sense to me. And so I hope that it makes sense to you too. And it's exactly this idea of just again focusing on the breath, just conscious breathing. And I find nighttime, as you say, Marilyn, is a great time to do something like this because it gets us into that relaxed state, especially if you're struggling with getting good night's sleep and
Mhm.
things like that, can really calm the body and the mind. So here's what CAMH, the Center for the Canadian Association of Mental Health, has to say about mindfulness. So, mindfulness is a way of being. It's a skill developed by deciding to slow down and take the time to pay attention and be curious about things that we're experiencing and things that we see around us. Each of us can be mindful, we just don't do it often. Mindfulness comes from Buddhism. It can be religious or non-religious, and therapies today use it in both ways. Most people new to mindfulness first work on these three main parts of being mindful. So the first part is attention. Attention means that we're aware of things in and around us. This includes attention to internal thoughts, to our feelings, to our body sensations, what's happening in our environment. Paying attention to specific experiences, like sensations that come up, like when they give the example, like when we eat a meal. Why is attention important? We spend a lot of time thinking and focusing about the future. We forget about the right here and the right now. And so attention can help us to take notice of things, enjoy things in our present moment, understand things about our lives. Not everything we notice will be joyful, and that's okay. We may notice we're tired or we're in pain, but those observations are still useful. Mindfulness means curiosity. This is the third part. This is exploring without judgment. So we look at our thoughts, we look at our feelings, we look at sensations as from a perspective of an explorer. Examining different perspectives, we can better understand what's going on. Curiosity helps us to examine situations more objectively. It helps us to relate to things a bit different than usual. Our common habit is to judge our thoughts, sensations, and experiences. And so this is all about exploring without judgment, exploring without causing ourselves distress. So for example, they give the example, a small disagreement with a friend can lead us to have unrealistic fears about the relationship. So practicing mindfulness can help us stop judgments and just help us to notice those thoughts that we have. Sorry, that was the second part of mindfulness. The third part is acceptance. So embracing the moment as it is, both good and bad. Resisting our urge to change it. That if something is uncomfortable, we have to change it. Acceptance is important because the more we try to control or change things, that doesn't necessarily mean that that's the best approach. So if we have feelings of a lot of anxiety, for example, it's easy to get caught up in those uncomfortable feelings, to try and stop those sensations, to feel angry at ourselves for not being in control of those anxious thoughts. But acceptance in these cases might mean simply acknowledging we feel anxious and letting those feelings be known and know that those feelings will pass. So this attention, curiosity, and acceptance can have a huge impact on the way we feel, how we live our lives. And as you may notice, because I'm thinking this too, all well and good to say it, really hard to do. And so that's why it requires practice.
Mhm.
So I then thought to myself, okay, I know this for me, I know this about mindfulness. Me, myself, I do yoga. I do find it relaxing. I do find myself trying to do these things to notice, to accept, to be curious. But, what research have to say? What's research saying about this? And I was actually very pleasantly surprised that there was a very recent research article, and I have it shown here from August of last year, that looked at mindfulness techniques in those living with pulmonary disease, which I found amazing because sometimes we hear about these things in other diseases and not necessarily pulmonary disease. And so it's nice to kind of just see, can this really help us when living with a chronic lung condition? And so this was a large review. So these authors looked over 20 years of research articles with key terms with mindfulness, key terms for what kind of chronic lung diseases. They had a rigorous review, so a way to go through all these studies. And they ended up with 13 studies that they looked at really, really closely. And so what I learned from reading through their article was that mindfulness techniques supports our psychological well-being through these ways. Very similar to what Cam H had to say about it. It improves our attention control, our ability to sustain attention and not to get easily distracted. It improves our emotional regulation, our ability to observe our thoughts and reduce those recurring thoughts we all get sometimes where we just ruminate on something over and over. It improves our body awareness. So just being aware that we feel breathless or we feel pain or we feel fatigue. Sometimes we push ourselves so much and we're not noticing our bodies giving us signals along the way until we crash. So that added body awareness can be helpful. It promotes decentering. So that idea again about observing thoughts, observing emotions, trying to step away from it and to be that explorer or observer instead of kind of sitting in it. It promotes acceptance. So accepting that, okay, I do feel breathless, but maybe knowing I've got breathing techniques I've got coping mechanisms for this, even though I feel breathless. It improves mood and quality of life. And this is what was so key. So why I was so excited about this study, because it showed that it significantly reduced anxiety and depression in those living with chronic lung condition. Regular mindfulness practice. And so often they're suggesting, picking something, and I'll go through what that something is in the next slide, but kind of sticking with it for 3 to 6 months fairly regularly. And it can do these things. What are the techniques? Oh yes, Marilyn, go ahead.
As you know, I wear a Fitbit watch, and so it measures my sleep quality and it measures my oxygen when I'm sleeping. And I know on the nights that I do the mindfulness, I don't do it every night, I might do it once a week, my oxygen is better.
Oh, neat.
Yeah.
Well done. Yeah.
It definitely is better during my sleep. Yeah.
Yeah. Interesting.
Yeah.
Thanks for sharing that. Yeah. That's a great, I invite you, any of you that have tracker devices you're wearing, just kind of just take a look at where you're at now and just kind of see if you adopt this, how that feels or what you see on your devices. In this particular review, everyone that was doing a mindful technique in their study did something a little bit different. So this is by no means a defined list. This is just in those 13 studies, this was the type of mindfulness technique that people did. And so one example was in China, they have like an online platform called WeChat. And so they did mindfulness virtually. It could be a guided audio session. So I know there are apps out there where you can just tap into an audio session. You could do a body scan. This is the one that I really like. Just head to toe scan of how you feel. One other technique we often use in this vein is called progressive muscle relaxation, where in each body part you tense muscles and then feel them release. There's mindfulness-based cognitive behavioral therapy. So this means changing negative thought patterns. So the mindfulness is set up in a way that you take those negative thought patterns and change them to positive goals. Mindfulness stress reduction is kind of, you go through a mindfulness maybe as a group, and then you have discussion afterwards. And then there's simple mindful breathing, like even just doing active cycle of breathing that we just did in a calm, way can fall under this. Mindful breathing with movement, yoga, all different examples. So we're just, I knew we might run out of time. I would like us to do a mindful breathing session together. It will take 10 minutes. So if you have 10 minutes to stay on, feel free. I'll extend our session. And if you don't, that's okay. You can pop off. This is getting recorded. But this, where I am pulling this mindful session from, I'm going to put the website into the chat, and I'll just offer that anyone, I've got a couple links, including the research article that I can get to you if you like. And the best way for us to do that is through our Poplar community, or you can email us at poplarpulmonary.com and we can send you an email. Our online Poplar community is free, and I know a lot of you are on there already. So we will post all these links in that chat. I'm going to post the link of the mindful 10-minute guided imagery we're going to do next in the chat here. This website, their mission, they're called Insight Timer, and their mission is they basically have a huge library of free meditations. And that's their mission, is to keep it accessible and free. So I feel good about this website, and I've pulled one of their meditations. So insighttimer.com. Okay, I'm going to reshare this screen here. So this is insighttimer.com. I've pulled one of their sessions that doesn't have a breath count. So some of their sessions have holding for a count of 4, let's say, exhaling for a count of 8. Again, like I mentioned, that's all going to be personal. So I pulled one that doesn't focus on that too much. I just realized, sorry, I'm going to have to share it again and just make sure the sound comes through. There we go.